Hello, everyone. Happy Friday. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here on Friday, February 12th, to give you a few updates regarding the impact of the COVID-19 epidemic on Mobile County. Let's see, today we are reporting an increase of 92 cases. So 92 cases were added yesterday, bringing the cumulative number of Mobile County residents with COVID-19 to 34,745. A total of 673 residents have died with COVID-19. 3 were reported to us yesterday. Good news from the State Health Department. They have completed working through the backlog of death certificates. So we're very happy and glad that they were able to do that. The cumulative number of patients hospitalized with COVID-19 has increased to 4,441. That was an increase of 12 on yesterday. And yesterday, the number of people in the hospital with COVID went down to 161. That's a decrease of 17. So we are happy to see more COVID patients discharged from the hospital to return home or to go to rehab. So that number has not been below 170 on any given day for quite some time now. So we're hearing from our hospitals that things are getting better. They have fewer people. They're, staffing and personal protective equipment and ventilators and all of that is getting back to the way things looked before this big spike began in November. So let's see. I've been getting, with cases going down and hospitalizations going down, we are proud of that, proud of you for the work that you're doing in the community to try to, slow down the rapid rate of COVID transmission that we saw due to gatherings and things around the holidays. So thank you so much for continuing to wear your mask, continuing to distance from other people that don't live in your household or don't live with you. Stay at home if you're sick or if you've been exposed to someone with COVID. And again, please remember that gatherings increase the risk of COVID-19 transmission. And now that the variant, the UK variant of COVID that we know is in Alabama, it's more infectious. It could potentially speed up transmission again. So it's really important, maybe more important now that we have the variant in Alabama, that we continue to do the things that we do to prevent transmission. Your personal behaviors make a difference. So please try to, stay safer at home. The Safer at Home order was extended, as we all know, through March 5th. And you're safer at home. Anything you do, in indoor spaces, if you go into a grocery store or into a restaurant or a bar or into a church or into a funeral home, into a sporting event, you are increasing your risk of COVID transmission or getting infected from COVID. So outdoor is better, shorter periods of time are better, fewer people, right? So we'd rather you gather only with people in your immediate household. When you're even having family gatherings, try to maintain distance and wear your mask. So let's see. Lots of questions about the carnival season. Most of us probably would have already have attended a couple of parades by now if this were a typical carnival season. But with the parades and the balls being canceled this year due to extraordinarily high rates of COVID transmission, everyone is kind of itching to express themselves, I think, celebrate Mardi Gras in some way. So please, have small celebrations, maintain physical distance, because we're really worried about large gatherings and the impact that might have on the gains we're making in slowing transmission. So please consider, the stay-at-home order, the safer-at-home order, rather. And if you do get out and about, follow the guidance. carry some hand sanitizer if you're going to be outdoors, strolling to look at Yardy Gras, or if you come downtown, just make sure you keep yourself safe, protect yourself and your family. All right, let's see. The Mobile County Health Department continues to give second dose vaccines this week at the Mobile, Alabama Cruise Terminal. We have a big event tomorrow. We have nearly 1,000 people to give second doses to tomorrow at the cruise terminal. So, but just want to remind you that USA will also be having a COVID vaccine event at the Civic Center tomorrow. So please make sure that you get in the right line. So they are giving away Pfizer, and we are doing second doses of Moderna. So please make sure that you are in the right line, because we want to make sure that we get you into the Civic Center to get your Moderna second dose. I'm sorry. Thank you. Sorry. Cruise Terminal, Mobile County Cruise Terminal, for your second dose of Moderna. Thank you, Mark. Appreciate that. Let's see. I think that might be about it. We only had a couple of questions. I think most of these have been have been answered. Most of the buzz right now is about people gathering for Mardi Gras, because I don't know if you all remember last year, but New Orleans had a normal Mardi Gras last year. So did Mobile, because we didn't have any cases at the time. But the very first death that was reported in Alabama, it thought was the person who passed away was a musician, and it was believed that he may have contracted COVID in New Orleans during Mardi Gras at musical events. And we know that there may have been other instances of that sort of thing happening. So, Mardi Gras is a mass gathering of epic proportions. And yes, it can become a hot spot for COVID transmission for sure. Any large gathering can. And now that we have even more infectious variants, we are concerned. So please, if you get out and celebrate Carnival this year, please try to take personal accountability for following the guidelines to cover your face, wash your hands, stay at home, certainly if you are sick or if you've been exposed. And if you find yourself in a situation where the mask ordinance is not being enforced, where people are not maintaining 6 foot distance, then please leave and protect yourself and your family. All right. And then there was another question just asking about sort of overall in general how vaccinations have been going in Alabama. This week was the big push by ADPH in partnership with hospitals across the state to try and provide 50 to 60,000 doses of vaccine in 1 week. And I think they're going to greatly exceed that goal, but we won't know until next week how many doses have been given, because as we said, there are Saturday clinics. So I think things have been going very well. Some of us have chatted with one another or shared with one another that before COVID, if you had asked us how many vaccines we'd be able to give out in a day, we may have said a couple hundred. And so we're all learning that we can give, several hundred doses an hour. And so we're getting pretty good at it. So as soon as we get more vaccine, we'll be able to get it out to more people. So please be patient again, as the national vaccine supply is quite severely limited. So that's it for today. Remember, second dose Moderna tomorrow at the cruise terminal if you got vaccinated at the health department on January 16th. Tomorrow's your day. All right, have a great weekend, everyone. Happy Valentine's Day. We'll be back. Our offices are closed to the public on Monday and Tuesday. Thank you, Mark. So we will return to Facebook Live on Wednesday. Happy Mardi Gras, everyone. Have a great, safe weekend.